My name is Emily Witowitz, and this is my Evidence-Based Practice Project Grant Proposal. The driving force behind this project is the mental health crisis we are currently dealing with in this nation. In 2018, the leading cause of death among youth ages 10 to 24 was suicide. This has worsened even more since the start of the COVID-19 pandemic. From 2019 to 2021, emergency department suicide attempts among girls 12 to 17 years old in the United States increased by over 50%. These staggering statistics led to the American Academy of Pediatrics declaring a national state of emergency in child and adolescent health on October 19, 2021. While the American Academy of Pediatrics and the CDC recommend increasing prevention and screening practices, there are unfortunately many times when it is too late and pediatric patients end up in the inpatient setting after a mental health crisis. Furthermore, due to the lack of psychiatric beds nationwide, there are very high rates of pediatric patients involuntarily admitted on psychiatric holds to inpatient medical units where they receive very little mental health treatment. The baseline anxiety that many young individuals feel is heightened during an involuntary hospital stay. In the general population, research has shown that therapy dogs can decrease this anxiety. Therapy dogs are commonly used in the inpatient pediatric setting. Research has also shown that therapy dogs are effective in decreasing the anxiety levels of the following subgroups: pediatric oncology patients, developmentally disabled patients, healthcare staff, and nursing students. There is a gap in knowledge, however, on the effect of therapy dogs with pediatric inpatient psychiatric patients. Therefore, the purpose and title of this evidence-based practice project proposal is to study the effect of therapy dogs on anxiety levels of pediatric patients and mental health patients. These are the three research questions this study aims to address. Does using a therapy dog decrease the level of anxiety among pediatric inpatient psychiatric patients? What barriers exist in using therapy dogs in the inpatient pediatric setting? And do nurses support the use of therapy dogs on inpatient pediatric patients? The theoretical framework for this study is Betty Newman's systems model. This framework states that stress reduction is the goal of nursing care. Newman identifies primary, secondary, and tertiary prevention measures to reduce stress on a patient. Therapy dog sessions would be considered secondary prevention because they treat or reduce symptoms following a reaction to stress. Therapy dogs may aid in reducing anxiety after the stressful event that brought the patient into the hospital. The proposed study is a mixed methods quasi-experimental study. Participants would be involved in 30-minute therapy dog sessions twice a week. Questionnaires would be completed by participants before and after each session. These would yield quantitative data. Questionnaires would also be completed by staff to assess barriers and their perspectives of this intervention. These would yield qualitative data. The fact that results will consist of quantitative and qualitative information makes this a mixed method study. It's also a quasi-experimental study because it studies the cause and effect relationship of therapy dog sessions and anxiety. There is less control in quasi-experimental studies than experimental studies, but this is expected with an inpatient setting. The proposed setting for this study is the inpatient pediatric medical surgical unit at a large New England teaching hospital. It is a 26-bed unit that cares for patients from 0 days old up to 18 years old. Along with pediatric medical surgical diagnoses, the unit also cares for many patients with psychiatric and behavioral health concerns, most commonly suicidal ideation or attempt. Therapy dog sessions would occur in patients' private rooms. The dogs would be accompanied by a member of the child life team. The proposed time frame of the study is 6 months, but can be extended until data saturation has been reached. Participants will be recruited via purposive sampling by their nurses. Staff will be asked to assist to identify individuals who meet the following inclusion and exclusion criteria: the patient must be 7 to 17 years old and admitted to the inpatient unit for a psychiatric or mental health concern. Individuals who are allergic to dogs or who display aggressive behaviors that would put themselves, the dog, or staff at risk for injury will be excluded from the study. The number of participants is estimated to be about 10 to 20. Although the sample size is small, as previously stated, the study will continue until it reaches data saturation. The informed consent shown here will be given to all participants prior to being included in the study. Since these patients are under 18 years old, the consent must be signed by their parents or guardians. Assent, defined by Gray and Grove as a child's affirmative agreement to participate in a study, will also be collected. Prior to beginning this study, approval from the IRB will be obtained from the hospital in which the study is being conducted, as well as from Regis College. I will apply for expedited review due to the fact that the study poses minimal risk to its participants. Minimal risks posed to participants include that the therapy dog could cause negative emotions such as fear, loss, and sadness. Patients will be made aware, however, in the informed consent that they are free to leave the study at any time. Confidentiality will be maintained by assigning numbers to participants. The records will be kept private in a securely locked drawer in a locked office. No published records will include any information that would make it possible to identify any participant. Results from the study will be communicated to the patients following completion of the study. Prior to and following each therapy dog session, each patient will complete two questionnaires, the STAI and the Visual Analog Scale. The State Trait Anxiety Inventory Scale is a self-report questionnaire that consists of 2 scales of 20 questions each. One scale measures the current situation, or state anxiety, while the other scale measures inherent or trait anxiety. Since the participants in this study will be between 7 to 17 years old, the STAI for children will be used on those 14 years old or less. This is simply a modified scale that will be more effective to use with younger patients. The Visual Analog Scale is the second instrument that will be used on the patients to collect data. This is a 10-centimeter line on which participants will mark the spot on the continuum that adequately measures their anxiety level. As you can see, on one end of the anchor will be labeled No Anxiety, and at the other end will be Most Anxiety Ever Felt. This tool is more sensitive to changes in responses than the numeric scale. To assess the 2 research questions related to barriers and staff perspectives, an online questionnaire using SurveyMonkey with 5 open-ended questions will be emailed to all nursing staff on the unit. The questionnaire will contain the following questions. Do you believe therapy dogs are effective in decreasing anxiety levels among pediatric inpatient psychiatric patients? What barriers exist in implementing therapy dog sessions with pediatric psychiatric patients? Do you believe these barriers are worth addressing in order to expand this therapy? Do you support the expansion of the use of therapy dogs with inpatient pediatric psychiatric patients on your unit? And please offer any specific examples of positive or negative experiences you have witnessed with this therapy in this patient population. Remember to not include any patient information. The hypothesis is that the therapy dogs will be effective in decreasing anxiety levels of pediatric inpatient psychiatric patients. I also hypothesize that there will be some barriers identified, but that nurses do support the use of this therapy. Therefore, the proposed change is that hospitals can work to expand these services and therefore improve patient care. Funding can be an issue for special services such as therapy dogs, but evidence to support this intervention may make it easier to address this barrier. I can speak from personal experience that it can be a very helpless and often frustrating feeling caring for inpatient psychiatric patients who are medically cleared. They're limited to what they can have in their room since our primary goal is to keep them safe, and so they often get bored and more anxious. I cared for one patient who was very withdrawn, not interacting with staff, and had severe PTSD which led to stranger anxiety. This was difficult since every 12 hours a new one-to-one sitter and nurse would be introduced to her. She started seeing the therapy dog, and I felt like I saw a whole new person shine through. She was more hopeful, less anxious, and much more interactive with staff, especially in the presence of the therapy dog. According to the CDC, from March 2020, the beginning of the pandemic, to October 2020, emergency department visits for mental health emergencies have continued to grow exponentially. For children 5 to 11 years old, these visits grew by 24%, and for kids 12 to 17, they grew by 31%. As the American Academy of Pediatrics stated, we are in a state of emergency with pediatric mental health. We must address this problem and also support this growing population of individuals who remain stuck in pediatric inpatient units for weeks on end. Because of these reasons, I urge you to choose my proposal for this grant. Please contact me with any questions you have regarding my research plan. Thank you for your time and attention. I look forward to hearing from you.